Welcome to Voicing Lived Experiences. Today we turn our attention to a barrier that can render essential services inaccessible and leave individuals vulnerable and unheard: the language barrier. For many migrant women in Scotland, particularly those from Black and minority ethnic communities, the lack of adequate translation services in crucial settings like healthcare and social services can have profound and sometimes devastating consequences. We'll explore this through the experiences shared by Anna, an evaluation and impact officer at the Community Bridge Centre, an organisation dedicated to supporting these women. The Community Bridge Centre works to break down barriers to participation in social, economic, and political life for migrant women. A primary hurdle, as Anna explains, is often language. While many women come to learn English, their immediate needs for accessing services often can't wait.
What's really important is making those connections between women and the services and their rights, which, if you don't know about them, you're not going to be able to access them. We try helping services to understand how they can improve their own work with different communities.
However, Anna highlights a critical and persistent failure within statutory services, a failure that directly impacts women's health, safety, and rights.
The statutory services, and this is my big bugbear at the moment, they do not provide translation if they can get away with not providing it. And that's not just the NHS, it's also social work. It's the police, which is horrendous. It's not just that you can't access the service that you need, but it's also that you get a positively negative outcome.
Anna shared a striking example of how this failure can escalate.
We had somebody that ended up going to court. She'd phoned up the police to complain about a racist neighbor. They didn't get translation for her. They listened to the neighbor. The neighbor said that she'd attacked them. She ended up in court. Got chucked out, but she'd gone through all of that trauma first.
This lack of translation is particularly dangerous in healthcare settings, where clear communication is paramount, especially for women with disabilities or long-term health conditions.
You get women ending up taking their 8-year-old granddaughter with them to a doctor's appointment so that they can translate. I had a situation where I put in a complaint because somebody had given authorization to have an operation and she hadn't had the form in her own language. She'd signed it because somebody sticks a form in front of you and says, "Sign here." She didn't know what it was. It could have been a really massive decision and she wouldn't have known what it was.
The consequences are far-reaching. Women are unable to understand their treatment options, their rights, or the complex systems they need to navigate for support, including disability benefits.
Firstly, they won't know what benefits are available. They may not have the IT skills to apply for benefits because it's basically the only way you can do anything these days. If you don't understand the letters that you're getting sent, then you know you can't do it. You miss your deadlines. And it takes a long time for our staff to sort of get the full picture.
Anna stressed that the solution isn't about creating new services, but about statutory bodies fulfilling their existing duties.
The main thing that I would really like to have the money to do something about is the translation services. It's there already. It's just that professionals either don't understand or they're worried about the money. We need to reinforce the fact that not providing it is failing in their statutory duties. And realistically, is leading to probably the worst health outcomes because it will mean that people aren't getting the right treatment.
The duty to provide understandable information and access to services is fundamental. Without it, the most vulnerable can be left isolated, misinformed, and unable to access the support they are entitled to. Ensuring professional and readily available translation services is not just a matter of good practice, it's a matter of human rights and essential for true inclusion. Thank you for joining Voicing Lived Experiences. We hope this discussion has highlighted the critical need for accessible communication in all our public services. In our next episode, we reveal what's known as the poverty premium faced by many disabled individuals.